Hello, hello. Good morning, everyone. Welcome to day 2 of the inaugural Virtual Women's Health Summit. My name is Dr. April Piercy, and I would like to welcome you to a wealth of information that's getting ready to be provided to you this morning. So yesterday, I just want to recap. We had a wonderful group of women to talk about some important issues. So here we are today, getting ready to learn some more vital information for our survival to keep us in a place where we're able to continue to learn to take care of ourselves. So, without further ado, I would like to present to you our first presenter. Her name is Beverly Hale. She's an RN, a BSN, and she's also a board certified case manager. Her topic this morning is Take Care of Me with No Excuses. Bev, you're up.
Have to unmute me. There you are. Okay. April, I was waiting for you to unmute me. Can you hear me? Just nod your head. Okay. I have headphones in. So, all righty. Good morning, ladies. My name is Beverly Hale. I'm a registered nurse with over 20 years experience, currently working as a case manager at one of the campuses of the New Jersey Jefferson Healthcare System. I have worked in many facets of nursing, from trauma ICU to med surg to brain injury rehab, home care, and hospice. I have a strong interest in holistic health and have used such practices to improve my own health. I currently work to assist patients in discharge planning and assisting them with a transition from the hospital to the next level of care, whether it be rehab, home, with home care, or medical assistance. I find myself constantly advocating for my patients, mainly my Black and Brown patients. As Ashley Smith mentioned yesterday, we have a very racist healthcare system, and some days it is truly exhausting when I have to confront my counterparts and the doctors to do the right thing, which leads me to the topic that I will be discussing today. I will be sharing my screen. All righty. My topic is taking care of me without excuses, mind, body, and spirit. As I work as a full-time case manager, I have not missed a beat since the start of this pandemic. Let's face it, I don't think there's one person in this room, this Zoom, that hasn't felt the effects of the pandemic. But first, I want to wish you all a happy new year. What are some of your resolutions for this year? Are you working on those 2021 goals? And have you created those vision boards? I have. As you can see, you can probably see it behind me, which is not the best, but it keeps me focused and reminds me of what I have set forth. So, what's on your mind? With the pandemic, I'm sure we go through a lot of emotions, including fear, anxiety, anger, depression, and joy. Let's talk about fear. With this pandemic, I know a lot of us are fearful that we may even contract it or what it's going to do with us, to us. We don't have a true understanding. It causes anxiety. Being around people when they say you have to stay masked up, social distance. I've been in the grocery store and people get too close, and it does cause a little angst, like, back up. You're within those 6 feet. Anger. A lot of us are angry, feeling that our restrictions and our living has been infringed upon. We can't socialize like we used to. We're angry. Some of us have lost loved ones or even friends, not to mention all the racial unrest that's occurring amidst the pandemic. And let's talk about depression. When you lose someone, if you're lonely, the losses tend to cause depression. You're lonely, you're shut in, that causes depression. Lack of companionship causes compression. It becomes just too much sometimes. So what do we need to do? We need to try to seek joy and happiness in any way we can. Reach out to family, find some joy in the midst of the day. It's easy to complain. It's easy to get caught up in our feelings, but there is always something to be thankful for and find joy and happiness in. Just the fact that by the grace of God, we haven't been affected by the pandemic of this virus. And if we have, we've come on the other side because we're on this Zoom today. So I want to talk about how I mentally prepare for the day. After taking care of my spiritual aspect, which I will talk about, I begin each day. I'm just going to, my Zoom is a little slower, so I just want to let it catch up. With the health, let's talk about healthy practices. I begin each day with morning stretches, yoga moves, a few crunches and leg lifts, and a 10-minute meditation to quiet my mind and set me in a positive mood for the day. Always reminding myself not to allow anyone to steal my joy, not to allow anyone to steal my power. Let's talk about the benefits of meditation. Meditation can lead to pain reduction. It enhances the body's immune system. It decreases feelings of depression, anxiety, anger, and confusion, which we talked about. It increases blood flow and slows the heart rate. And it provides a sense of calmness, peace, and balance. It reduces stress and helps control thoughts. I also end my day with a 10 to 20-minute meditation before going to bed. So let's talk about the body, ladies. How are we doing with the bodies? I'm sure I'm not the only one who's developed a few Rona rolls with all of this. Yes, I call them Rona rolls. I know we've been shut in. We've been cooking more because we're not going out as much. And we've put on a few extra pounds. So what are you doing to take care of your bodies? Let me speak of the practices that I engage in every day. I will speak of my dietary habits first. I make sure I drink plenty of water. Upon awakening, I drink lemon water, at least 20 ounces, which I sit at the bedside at night. So it's there first thing when I wake up. Since the start of COVID, I've been working on even harder to build my immune system. Remember, with any virus, whether it be a cold, flu, or the corona, it has to run its course. Because a virus there's not a cure to those. But when we take medicines for viruses, we're only treating the symptoms. So remember, the best defense is a healthy immune system. So I drink my first meal of the day, which is a green smoothie. It consists of kale, spinach, green apple, banana, chia seeds, ginger, and almond or coconut milk. My daily job consists of at least 2 Zoom meetings per day, sometimes up to 4. So my job is kind of sedentary throughout the day. So every hour and a half, I try to stand up and stretch. If I'm on the meeting, I have the ergonomic desk that rises up. And when I'm not on the Zoom, I try to get up and take the stairs down to the first floor and walk back up, trying to get that walk in. Drinking plenty of water throughout the day. And I try to keep my body in an alkaline state, which prevents cancer-causing agents. Cancers tend to thrive on an acidic environment. Even though lemons are acidic, once you consume them, it turns your body alkaline. So that's what I tend to do. We want to build the immune system. We want to drink those at least 64 ounces of water. If you're exercising vigorously, you want to drink more than that. Let's consume healthy diet, rich in fruits and vegetables, 6 to 8 servings, avoiding the sugary drinks, processed foods, alcohol, avoid mucus-causing foods or mucus-causing agents such as your sugar, your white flours, your dairy. Taking your multivitamin and the vitamin C supplements, vitamin D, as we were talking about yesterday. The best vitamin D comes from the sun, but if you're not getting all of that, a supplement can't hurt. Getting the proper amounts of sleep and monitoring your weight. So once I'm at home, I'll get back to my practice. Once I'm at home, I immediately walk my dog because that's her routine. It helps me to unwind. And once I bring her back, I do 30 minutes on the treadmill Monday through Friday. Since it's winter, I can't get outside because it gets dark too early. And I do a light weight workout, alternating upper and lower body depending on the day. I try to have my dinner by 7 or 7:30. And after dinner, I always want to wind with either a book or a little TV watching, but be mindful of the time. And I do a few yoga exercises prior to going to bed. I do have a yoga CD, but there are many yoga classes on YouTube. One lady I follow, it's called Yoga by Adrian, yes. I try to get 6 to 7 hours, 6.5 to 7 hours of sleep. It seems to be just the right amount for me. When sleeping, try to keep your room a little cool because it helps you to rest a little better. If it's too hot, our sleep will be interrupted. You know, I can speak for myself. If I'm too hot, the covers are on, the covers are off, back and forth. So it's disrupting your sleep. And as I mentioned, I'm into holistic health and nutrition. So I like trying healthy alternatives to traditional soul foods. I remain focused on the diseases that plague our race and in our communities. And I'm very mindful of what is healthy and what is not. I am in a few organizations and I have a lot of family and friends that I love to share diet and nutritional tips with. And also along with resources that I pick up along the way. Let's speak of, like I said, what to eat. We talked about the water. I know a lot of us don't like water, so to make it more palatable, you can put in lime, lemon, cucumber, some even like ginger. And I like a plant-based diet, which I've recently transitioned to. It's not for everyone, and it does take some getting used to. And it is difficult. So if you're still not on board with the plant-based diet, let's make sure your meats that you're consuming are lean meats and making it the smallest portion, like the size of a deck of cards, making the smallest portion on your plate and making the veggies and the fruits, you know, more of what you're eating. And lastly, alcohol. Try to avoid alcohol, at least limit your consumptions. I know routines. I have a whole regimented routine, and it may sound a little boring, but it works for me. It keeps me balanced and keeps my stress level down. Just remember, ladies, if you shift the mindset, then the whole vision will change. And once the weather's nice, of course, I will definitely be outside, getting in. I love being outside. I love being with nature. I love riding my bike. I love the walking, all of that. So right now I'm feeling trapped with all of this cold. So lastly, let's talk about what feeds our spirit. Being thankful, spiritual reading, prayer, and attending religious services. Like I said, I mentioned my routine. In the mornings, I do first and foremost start out by thanking my God for allowing me to see another day. I read my daily bread every day, followed by the reference scriptures, along with two of my favorite, Psalms 23 and Psalms 46. I then follow by, I read these Sacred Woman affirmations by Queen Afua. And then the word I feel just prepares me spiritually. It helps me to put on my armor and leave my house with the confidence that I am covered. Since most churches are closed, a lot of us aren't going out. I know there are a few churches open, but I'm not there yet. So I tend to watch services on Zoom on Sundays, preparing for the week ahead. But lastly, the last thing I want to touch on before we open it up for discussion, I wanted to talk about being our sister's keepers. I am my sister's keeper. What are you doing for others? I know it's hard. A lot of people live alone. So what are we doing? Are you checking on friends, the elderly, those that are shut in? Are you making a phone call, sending a card? You can always run an errand, call up, see what they need. You can drop it off at the porch. We don't want to like go in, especially with the elderly. We don't want to go into their homes and take a chance of infecting them if you are a carrier. But let's do just the small things, serving others. And what can let's do what we can while we can. And I will leave you just sharing a personal journey of mine. I just wanted to speak about my sister. And when I speak of my sister's keeper, I mean, she comes to mind as this past October 2020 was the first anniversary of her death. She lived in North Carolina. She's a corrections officer. She worked long hours, 6P to 6A. She came home from work on a Monday morning after working 12-hour shifts, and she didn't make it. She was off for 2 days, Tuesday, Wednesday. She should have been back to work at 6 p.m. And she was, very regimented, prompt, never late. So she didn't show up for work. 6 o'clock came, her sergeant's like, okay, where is she? A couple hours went by, which was definitely not like her. So he sent out a the wellness check with the police, and deceased in her bed. This was on a Wednesday. She had gotten off work early Monday morning. So she would have been deceased for a couple days in her home with her dog. So it just makes me think, and I kind of question myself, could I have done more? Should I have done more? Should I have called more? Should I have checked on her? So let us not be burdened with the question of, could I have done more? Should I have done more? Let us do more while we can. Let us love like there's no tomorrow. And let us make memories with the ones we love most. Thank you for your attention. God bless you all. That is my presentation. I appreciate you guys.
Thank you, Beverly. Okay, so ladies, if you have any questions or comments, please go to the chat and I'll begin to read them to Beverly. You do have two comments here about their condolences to you.
Thank you.
And they thank you for your presentation.
Thank you. And I thank you for the opportunity,
ladies, don't
April.
be shy. Ask some questions. Oh, you're quite welcome. Again, the condolences. I know what it's like to lose a loved one. Great presentation. God bless you all. Love like there's no tomorrow. Thank you for your presentation. I have a question. So a question is about to come up for you.
Okay, sure.
Explain how lemon water is changed. Explain how lemon water changes our body internally, even though it's acidic?
According to the pH of our blood and our whole system, once you introduce it into your system, the pH goes down as opposed to up or vice versa, but it goes up, sending it converts the acid into an alkaline state. Along with the lemon water changing your body to an alkaline state, there are a list of vegetables that are alkaline, which I can, if you want to email me, I can give you a whole list of alkaline fruits and vegetables that you can take in. I did see another question.
Yes, you see it. I tend to gain weight around the midsection. Is there anything can do to prevent this? Do you recommend any dietary changes? I know I eat too many carbs.
And that is the main the main thing. And stress, when we're stressed, we develop cortisol. The cortisol levels go up, and for some reason, it's with women, the stress tends to affect the fat cells in the middle, our middle core, middle body, and that's why we have the obesity. You have to carbs or a no. I know it's hard, but there's so many good things to eat, the fruits, vegetables. Just, you would be surprised, just increasing your water, getting a little walk in. And a lot of times that midsection, you'd be surprised what's in your intestines. Do like a good cleanse, I would say make sure you're eliminating at least twice a day. When we have a really good digestive system, we're supposed to eliminate after every meal. What goes in is supposed to come right out. That's optimal digestive level, but we're not all there. But let me just say, ladies, since this is like my 5th week of being no dairy, no processed foods, and no meat, and I can honestly say, just doing that, I'm not missing the meat, and I'm going to the bathroom. I'm eliminating 2 to 3 times a day, when before it was 1. And I mean, if you do that, drinking the lemon water, I drink it at bedtime too, but I try to cut off my liquids by like 8 o'clock, no later than 9, because you don't want to get up peeing all night long, because then that's interrupting your sleep, and you need those 6 to 8 hours of uninterrupted sleep. You wake up, you'd be surprised how you feel. But I can honestly say, cutting out the meat and the processed foods, that flour and all of that, I used to get up, because I'm over 50. I used to get up, my joints would, like, I get up in the morning, I'm like, damn, why do I feel like an old lady? My knees would hurt. But since I'm sure a lot of you can relate, but since I've stopped with all of this meat and dairy, I'm out of bed and I'm not complaining. My joints feel a lot better. I go and do my stretches. I'm like, okay, I totally feel the difference. So I can only speak for me, but this is my personal testimony. I know it works.
Please touch on COVID-19, the issues it causes once one has recovered. So basically sounds like the side effects.
Yeah, side effects of it. Now, I've had quite a few patients that have come into my hospital and have returned to my hospital, a second bout of COVID. But a lot of times with COVID, it affects your lungs. If you have a really bad case of it, you develop holes in your lungs. It affects your whole lung expansion. So as a case manager, I'm sending a lot of people home with oxygen. In the hospital, they're treating patients when they come in with the COVID, they call it COVID pneumonia. They're treating them with an antiviral and AIDS medication. It's called remdesivir. They give them a 5-day course of that. And it's not for the COVID, it's actually for the congestion in the lungs. It helps with the whole lung, trying to improve and heal the lungs. That's the purpose of the antiviral, because like I said, there is no medication to heal COVID. I know they've developed a vaccine. Vaccines only kind of slow down or prevent really severe cases of an illness. That's what vaccines do. So that's what they're doing as far as the vaccine. Like I said, there's no cure. Other side effects of COVID-19 are the severe headaches, blurred vision, memory fog. I've heard a lot of people say that they have memory fog. Some people have developed blood clots. If you develop the blood clots, whether it be in your legs or your lungs, then you're on a blood thinner for at least anywhere from 4 to 6 months. And blood thinners are really expensive. When you Coumadin is one that you have to have lab work done 2 to 3 times per week. But there's Eliquis, which you don't have to have the lab work done. However, if you don't have good insurance, Eliquis is upwards of $500 to $600. As a case manager, I'm having to get that approved for people weekly, and not all of them can afford it, and then you're stuck with the Coumadin, which there are other side effects with Coumadin. You can't eat your dark leafy vegetables and all of that because of the effects of vitamin K. So the best, like I said, the best defense against COVID is a healthy immune system, trying to avoid getting it. But if you do, you want to make sure, if you're having symptoms, let's say if you're living alone, make sure you reach out to someone. Look, these are my symptoms. I'm not feeling well. Don't ignore your symptoms, ladies. If you have a headache that won't go away, if you have this shortness of breath that you're not normally stricken with, let's say you want to say, well, let me just maybe reach out to go get a test, or reach out to your doctor. If they don't want to see you, or this telemedicine, which I'm not a big fan of, but I understand with the COVID, because I'm sorry, you can't listen to someone's lungs through a conference call. I mean, a video. You really need to be checked out. But if you're having any symptoms out of the ordinary, just a headache that won't go away. A lot of people, say, well, oh, I have a headache. Oh, it's just sinuses. And I can use my daughter as an example. She says, oh, I have a little congestion. I know it's just my sinuses. A week later, she got tested and she had COVID. But she had mild symptoms, but she thought the headache was just a sinus headache, and she's going to take some Sudafed or whatever. And she did, in fact, have COVID. With that being said, even though she only had mild symptoms, she could have easily come to our home with my husband and I, and could have given it to us. And we had, severe symptoms, you know what I'm saying? And like with my sister, she was exposed, and like she said, just like it's just my husband and I at home with her and her husband. They're the only ones at home, and the dog. What's going to happen if we both get COVID? Who's going to take care of whom? You know what I'm saying? So we want to be so careful, vigilant of just our practices, the hand washing, the masking up. If you're going to a grocery store, I know the little cloth masks are really cute, but guess what? They don't work. If you can blow out a birthday candle, COVID can get in. So my suggestion to you, if you don't have an N95, the surgical mask, put on the surgical mask, then put on your cloth mask over it. I don't care how cute those cloth masks are. You want to make sure you're protected. And if you can like order your groceries and have someone put them in the back of the car, do that. I pick up my groceries. I'm at Target with car delivery. I drive up to Sam's, have them put it in the back of the car. Anything, just limit your exposure right now. And I'm not trying to put fear into anyone's head, but it's just, let's be careful, ladies, because we don't want to go in the hospital.
Uh-oh. She froze.
And she stated she was back and forth to the hospital 3 different times. They didn't treat her fairly. They didn't treat her like she needed to be treated. And she eventually died. And she was a doctor. So if they're not treating the doctor fairly, we don't stand a chance. I'm not saying, and please don't let me put fear in anyone's head. It's not all hospitals. It's not all doctors, but as a whole, we know African Americans are not treated the way they should be treated. I just wanted to put that out there. Like I said, being in the hospital every day, I see it. And I just want us all to be healthy and whole and come out on the other side of this, you know what I'm saying? Just celebrating, praising God for getting us through. And at some point, we will be back at your house, April, at a barbecue. I will be back at my sister Deborah's house. I'll be going to Texas. My sister Deborah's on the screen all the way from Texas. I will be at her house visiting again. And I see my friend Kimberly from Rocky Mounts on too. I'll be able to go to North Carolina and visit. But right now, ladies, let's just be patient.
Mm-hmm. I have a question too, and also an observation. I have seen people wear and put on gloves. How effective are gloves? Because I know some people are very afraid of the COVID, But are gloves effective? Why or why not?
They are effective because the virus can live on surfaces, depending whether it's metal or plastic, for like at least 30 minutes. So if you're going to a grocery store, you're touching that cart that someone else may have had a bad cough and they're coughing on that cart and that handle, you're touching it. That is effective. But what I see with a lot of people that have the gloves, they put them on, they go through the store with the gloves on, they get back to their car, and guess what they do? They put the groceries in the car, they keep those gloves on, they're driving like a maniac to get home. Guess what? You done spread it all over your car and spread it on everything. So once you get out of the grocery store, take those gloves, take them in, and you have to be careful pulling when you take them off. Take those gloves off, discard them in a receptacle right there at the grocery store. You have your groceries, get home, you clean up, but as soon as you get in your car, keep the little sanitizer gels in there or the little handy wipes. Make sure you cleanse your hands before you're touching that steering wheel, because it's called cross-contamination. If you have it on your hands, like I said, you're on that, and I see plenty of people with the mask and the shield driving home in the car by themselves with all this on, those gloves on. Like, first of all, you can take you can breathe now. Take that mask off. You can take the shield off, and please don't get in the car with those gloves. Do not put those gloves. The gloves, to answer your question, I know I took a long route to get there, April, but the bottom line is the gloves are effective, but don't take them with you. It's not one pair fits all and you wear them all the time. Take them off. Don't bring them back home. You want to discard them.
No, I thank you for clearing that up, because I think although hopefully I'm asking a question that many have other thought about and didn't know to ask, because from my observation and looking at it, and also being in a medical field prior to what I'm doing now, I know how effective it can be. But if you're not utilizing it in the right way, you're right, cross-contamination can happen. Therefore, you defeat the purpose of what you're trying to do. So just kind of follow that regimen of what Bev is talking about, because you're only trying to save yourself from cross-contamination. So the next question here is, I would love the information for the alkaline fruit and vegetables.
Okay. Please, whoever's asking the question, I did put my email address at the end of the video, bevy1. I will put it in the chat, bevy1@gmail.com, and I will send you a list. There are so many fruits and vegetables, and they're good, and I find it very helpful. I'm more than willing to share any information. So whoever wants to, thank you for that, and I will definitely, if you email me, I will definitely send it right out to you.
Okay, and I have one last comment for you. It said, thank you. This has been outstanding information. I will use it daily. So Bev was saying that. Beverly Hale, we thank you so much for your presentation. You offered us so much information, and taking care of your mind, body, and soul is what she is talking about. So please make sure you practice this, because again, we want to take care of ourselves, because we will not be good to anyone else. So as her topic states, taking care of me with no excuses. Thank you again, Beverly Hale, RN, BSN, board certified case manager. We thank you.
Thank you.
All right. So next up, we have Tasheen Mungo. She is going to be talking about loving the skin you're in. I'm so excited about her presentation also, because she's going to be talking about some wonderful things about how we can take care of our skin. So Tasheen, you are up to provide us a wonderful presentation. Thank you.
Hello, everyone. Hello, I'm Tasheen. I'm a licensed esthetician in North Carolina. I'm going to share my screen with you guys. And if I'm talking fast, please just tell me. If someone can just tell me to slow down. 1 second. Share screen. Mm-hmm. One second, didn't know I was going to have to sign in. I think I'm doing something wrong. I apologize. 1 second. I don't know how to work Zoom that well.
No problem. Take your time.
Okay. Find my notes. Okay, can you guys see my screen?
There you go.
Okay.
Yes.
Thank you. 1 second. Okay. So the Virtual Women's Health Summit. Okay. I think I'm doing something wrong again. This is not working for me, ladies. I don't know how to do my Zoom.
Click down one time. Click down. Down arrow key. Okay. Now you need to find you see the, okay.
Nope, I messed up again. I
Okay,
think I'm on edit and I'm messing up my.
Yes, you just need to find to show the screen. I can't see. Dismiss the bar. Yes, I can see. Go to slide so we can see if you have the slideshow option. Go all the way to the top where it says slide. Okay, let me see. Nope. Okay. Close that out. Go to that where it says a T. Let me see what that looks like, what that's supposed to be.
Right here?
Yeah, there's a, okay, no, not there.
Well,
Well,
I don't know how to work Zoom.
Well, here it is. Go to present. You see all the way up to the top? That may be your slideshow there. You see all the way to the top where it says present? Try that. Down, hit the arrow again. Yeah, and you're gonna try to start from the beginning. Okay, present from beginning.
I clicked it.
And it didn't do it. Okay, go pull the arrow down one more time. And presenter view, let's see. With that's your view of it. Huh.
I think I hit edit when I was doing this.
Get rid of the slide that's in between. Right click and see if you can get rid of it, the blank one. Go back up, right click, delete it.
I did.
Okay, now try to do your presentation from the first slide. Click on the first slide. Okay, now where's the option to present? Okay, try it again. Let's see if it'll work.
It still didn't.
Okay, so you know what? Just click on, just keep going down.
Okay,
to your next one.
Okay.
Yep.
All right.
They can see it.
Okay. So let me just put down so I can see it. That's the problem. I can't see it. I can't see it to read it to you guys. My screen, you can see how my gray part keeps coming up. I can't. I don't know how to do it. I'm going to read it from my phone on Zoom. I mean, from my phone on I have it. Uh-uh. I'm sorry, April. I don't know how to do it.
Okay, so just present the information that you have, what you have.
Wait a
Okay.
minute. Okay.
All right.
I can't see it. And I'm mad because this is good information. But I can't see it to read it to you guys. So I'm just going to read it to you. I can't see it to read it to you guys. I can't see what y'all can see because I have it on edit by mistake. That's the problem. If I can take it off of edit, I'll be able to do it. I think I shouldn't have signed in when I came into this. So do you see the functions of the skin? Because the first question was, why was it important to take care of the skin?
Yes, I do.
Okay.
It says covers and protects the body. What does the skin protect us from? So you have pathogens, injury, ultraviolet radiation. Our skin is the largest organ we have. Skin is our protector, the barrier that has the first contact with the world. Without skin, we will get infections. It covers all our important organs and vessels. Facials provide full relaxation while double cleansing, exfoliating, toning, massaging, mask, moisturizing, and protecting. Aromatherapy oils can be used in specific massages. Facial is a form of cleansing. You got to go back up.
Sorry.
Facial is a form of cleansing. You should be getting double cleansings. Oil-based cleanses first, then with a skin-specific cleanser. For example, oily, dry, or sensitive. Facials are recommended monthly unless the client is getting time-sensitive treatment. Example, chemical peels. In my opinion, of a good esthetician is one that will always educate her clients, actively listen to her clients' concerns, and recommend home products to help with the corrective process. We as estheticians can't guarantee every treatment is going to work if an abnormal finding is found in a client's skin. The client has to be referred to a dermatologist, skin, nail, and hair doctor. We need to know that skincare isn't a luxury, it's a necessity.
Sorry.
Just like going to the medical doctor or therapist, they are all connected. Ladies, we have to take care of our mind, body, and soul. They're all one. It's never too late to get a daily routine started. A couple common skin conditions women of color have.
Let me see if I can see it. I want to
Okay.
say that is hyperpigmentation. 1 second. Yeah, so that's hyperpigmentation. That usually happens. That usually happens from acne, any type of scarring, any type of trauma. Like when we were little and we fell and we scraped our knees before it healed, it turned brown, and I have like little light dots. And then when we get our skin back, and that's called hyperpigmentation, and we get that all the time. Any type of trauma, our skin protects itself with the darkness with hyperpigmentation. The next one, that's eczema. A lot of African Americans get that extra dry skin, itchy. That condition, I would recommend to go see a dermatologist first, and then see an esthetician afterwards. Another one is dermatitis papulosa. I have that also. I always thought they were moles. It is inherited. I always thought it was moles that we get, but it is a condition that African American women get. It's not harmful. It's nothing you can do about it. You inherit it, and you get more as you get older. Is there any more slides down there? Oh, and let's see it. Polycystic ovary syndrome. A lot of African American women have this. A lot of us don't know we have it. We get like a lot of hair dark underneath our chin. Um, and we should go to a doctor and get tested to see if we have it first, and then get treated by an esthetician. And I apologize for the slideshow. I don't know how to use Google well nor Zoom. I'm just learning how to use it. And another thing I wanted to say through the whole yesterday and today, I wanted to say yesterday and today that vitamin D is definitely needed, but we have to wear sunscreen. We grew up thinking, I know for myself, thinking that only Caucasian people needed sunscreen. No, every Fitzpatrick on the scale needs sunscreen. UV radiation is bad directly on the skin. I don't go outside, not one day, rain. It doesn't have to be sunny. We still need sunscreen. Um, Again, I apologize, and if anybody has any questions, I'm here for them.
Okay, thank you. So, ladies, I'm going to go to the chat. If you have any questions or comments at this time about how to take care of your skin or what questions you would ask a dermatologist, please feel free to let me know, and I'll start reading off your feedback. Information is very good. God bless your persistence. That was good. Yes.
Thank you. Thank you for reading it.
No, yes, no problem. I'm glad that you mentioned that we need to wear sunscreen. So
Yes.
you did talk about the importance of sunscreen, but if you can elaborate, I would say on, you did touch a little bit on the myths. Uh, what is the reason why most African Americans say, okay, well, I don't need sunscreen because I have melanin? You know, that's
Right.
the statement.
That is
But
it.
elaborate on that more so it
Well,
hits home for us why.
right. Because the sun UV rays can give us cancer. Um, that used to be me. I would go away on vacation and my mission would be to come back dark. Like that would be my mission, to grease up and sit in the sun. I didn't care if I got burnt, because I felt like because I had dark skin, the sun couldn't come through my skin and burn me, which is incorrect. We get skin cancer, we age earlier, we get, so the dermatitis, what I showed you that look like moles, they get bigger, they get darker. All of that comes from UV sun rays. So sunscreen is very important. And as I said, it's not just when it's hot outside. Even the sun comes through when it's raining, when it's a hurricane, the sun always comes through, and the sun is strong. And we don't want cancer on our skin. We don't want to age early. So sunscreen is important. They have a sunscreen in Target that's called sunscreen for Black girls. That is very good. Then they have another one
Mhm.
that's called Super Goop, and it has vitamin C in it, because vitamin C is also great for our skin, especially for hyperpigmentation. If you have hyperpigmentation, and sunscreen also helps with hyperpigmentation. So we should use sunscreen SPF 30 or higher. If you have hyperpigmentation, you can use 50, and that will help your hyperpigmentation also.
Okay, you have a few questions here. Okay, can you elaborate on the condition after the eczema, the dermatose papillose? How is that treated again?
It's not treated. There's nothing you can do for it. It's not harmful. I just put that there because I know my cousins and us, we always have them, and we thought they were moles, just plain, just moles, freckles. Really thought they were freckles. And we always say to each other, oh, look, you got freckles. And as I was in school and seen it, and well, when I Googled it, because of course in my school, every condition was a white person. So they didn't show any black skin conditions. So when I Googled black skin conditions to learn for myself, I realized, wow, it's not freckles. It's not a mole. It's really a skin condition, but it's not harmful. It's nothing. I mean, some people probably can get them removed if they choose to. It's not harmful. You get them as you get older, and they are inherited, but they're just not moles. They have a name for it.
Okay. Next question here is, hi Tashin. I've always had very oily skin, which
Mhm,
triggers my acne. Is there
mhm.
anything you suggest I can use to control it for African American skin?
Yes. So oil cleansing is great for oily skin. I have very oily skin. I have adult acne. I have bad acne. I have hyperpigmentation. So companies sell oil pre cleanse like Dermalogica. I use grapeseed oil. So I wake up in the morning, I put grapeseed oil in my face because oil attracts oil. So if you put oil on your face, the oil is going to pull the oils out your pores. If you put water on your face, it's not going to pull the oils out because they counteract each other. So I wash my face with grapeseed oil, then I continue on my wash. So not coconut oil. Coconut oil clogs your skin, your pores. But another oil that's non-clogging, I can look some up. I have some, a list of some in my folder. You can oil-based clean with that. Or you can use Dermalogica. All of facial companies have now pre-cleanse oil. So that's great. People think when they have oily skin, oh, I shouldn't use more oil or I shouldn't moisturize because my skin is already oily. The opposite. So if your skin is oily and you dry it out and you don't use moisturizer on it, your cells are going to overwork trying to find oil. And then that's going to bring you acne. The cycle is going to go all over again. So if you already moisturize your skin, already oil it, your sebum, your skin pores, your oily pores won't overwork. So it won't look for more oil. So then it'll be, your acid mantle will be calm and it won't have no acne. So I am right now training to be an acne specialist with Face Reality Skincare. So I'll have more acne education in a couple of more weeks. But I do know some of the things that, what you're acne prone, some of the things that you should not do is not use dryer sheets because it leaves a waxy film on your clothes, on your pillows, sleeping on it. Do not use coconut oil on your skin, but you should digest it. Number one with acne is gut. As Dr. Beverly said, the gut. If your gut is clean, your acne will be clean. I suggest a probiotic every day. I take this in all of my drinks. It's a liquid Clairfol. It's supposed to be 15 drops a day. It turns green, but it tastes like nothing, but just seeing green weirds me out. So I put a couple of drops in all my drinks all day. And it's really, when I looked up the ingredients, it's really coconut oil, purified water, and Clairfol. And my face has been clearing up, and I've only been taking this for 2 weeks and using the bathroom, as she said, eliminating all them toxins, taking stuff to eliminate out. All of that has to do with acne. What's inside of you comes out of you. Your skin, as I said, is the biggest organ. It lets out. When you go to sleep at night, I don't know if I learned this in school. When we sleep at night, you know how you wake up and your tongue has a white film? That is toxins trying to leave your body while you're sleeping, and it cannot come up your esophagus. So it stays on your tongue. That is what that is. Toxins have to escape your body somehow.
Okay.
That's the best.
What's the difference? What is the difference between types of sunscreen?
The sun protection film, the SPF, that's what that stands for, how much it blocks the sun from getting to your skin. The best one, you start at 30. 30 is fine. 30 keeps you not being sunburned. It goes up to, I don't know how high it goes, but I know for my clients who have hyperpigmentation, I tell them to use 50 because sunscreen has oxidant something in it. Sorry, I don't know the name of it, but it helps with lightening also hyperpigmentation. It inhibits the sun from darkening the skin. So the higher it is, the more it inhibits the sun from darkening your skin, which keeps the rays from the skin.
Okay. Next question is, I have combined skin. What's good to wash your face with? Plain water or facial cleansing?
Water doesn't clean your face. Water is water. A
Mm-hmm.
cleanser cleans. And I can't really say without seeing your skin myself, even if it was on screen, to say what would be good, but something that's just um, a cleanser that I know of that um, it really depends on where is your combination skin. Is it more oily here? Is it dry more? I need to see because of oily, and it depends if you have some type of acne because it just depends because I like glycolic acid. So it just depends on, I can't really say. So it's this one cleanser. I gotta find the name of it that it's from Target. It's good. It's for combination skin. A lot of Black women use it. I'm in a lot of groups and they use it and it really works. I didn't order it for myself or for my clients, but if I give you my email address, you can email me and I will give you a list of good cleansers. But it's best if I give you my email address, whoever it is, if you FaceTime me and I can see your skin, and then I'll be better off telling you something that's better. So I'll put my email address
What do
in
you do for blotches? In the chat. Okay. What do you do for blotches?
in the chat, and she FaceTime me. Oh, you hung up, so I can see your skin. I will FaceTime you when it's over, Tamika. So for blotches, it depends, because if it's dry blotches, you need moisture in your face. So hyaluronic acid is great moisture for Black women. It's like fiber, like keeps our cheeks strong. That's why, you know how they say Black don't crack? It's because we have oily skin mostly. And oily skin, we think it's bad, but it's not. That's why we don't get wrinkles as fast as Caucasians, because our skin is not the same as theirs. We have different layers of skin. We have different texture of skin. It's not the same, not at all. I treat Caucasian women, I treat African American women. I don't use the same products on us, and our skin is not the same. We could be the same age and we look totally different, meaning our skin texture and everything. So oily skin is actually great skin. I always hated it, but it's great skin because we don't get as many wrinkles. So for blotch skin, we just have to more moisture, and I'll have to see it on camera to tell you what type of moisture is good for it. But we all should have a routine. And I'm not saying nothing that takes 10 minutes, but with a cleanser, a serum, a toner, a moisturizer, and sunblock. Those should be things that we use every day, morning, AM, and PM.
What do you think about what's the benefits of wearing or putting on masks, and how often, if it is beneficial, can we use them?
You can use them. It depends on what type of mask. So you can use the mask twice a week. So it depends on what type of mask, and masks are beneficial as long as you're using them specific. So there's masks that's good for if you have dry skin. After you already cleansed your face, put a serum on. You could put on a hydrating mask before you go to bed. And then when you wake up, your face is hydrated from having the mask, have had the mask on the night before. If you have oily skin, a clay mask is great. I use a clay mask on my face once a week. A clay mask takes all the toxins out of your skin. It's Izect. It's like a little one, everybody have it in their house, the powder. Izect Indian mask. Add a little apple cider vinegar to it. And I put it on my face, and when I say it gets so tight and hard, it hurts. And then when you wash it off, it takes all the toxins out of your skin. So I mask once a week. We all should have like a self-care day for ourselves, maybe Sunday. I do Wednesdays where I pull out my own little steam I bought from Amazon, and I steam my own face, and I give myself a facial. And I feel like if you feel like you look beautiful, the inside, the outside, you act beautiful. I feel like that all counts as each other, not meaning the beauty of how you look on the outside, the beauty from the inside. When you give yourself a self-love day, just to love yourself, just to show yourself, like, take time out for yourself. It doesn't have to be a long routine. I close my bathroom door, lock it, and I just go in there, and that's just my time. And we all need that. We all deserve that. We all should give it. It's like when I mentioned, like when I'm on the groups and I mention esthetician, they're asking me 1,000 questions on, how I can go to Target and buy this, how I can go to this. Those things have no actives in it. It's not going to cure anything you're trying to do. You cannot, it's like a doctor. You have to have a license to order certain products that's going to work, corrective products. So I can definitely tell you something to get from Target, but you're just going to be there's no actives in it. There's nothing in it that's going to stop if you need something corrective. Now, if you already have good skin and you just want to keep it up, you can get a cleanser, any cleanser. But if you have a problem, you have to see an esthetician. And we act like that's like something big. No, it's just like going to the doctor. You don't have to see an esthetician every week. You can go once a month. Sometimes you can go once a year. But we deserve it. It's like a necessity. It's like keeping yourself whole. Your skin, you only get one. I don't care what you can do. You only get one skin, and we have to take care of it because we want it to take care of us.
Okay. Your next question is taking a supplemental biotin helpful?
Yes, it is. Yes, it is. I think that and also with acne, I think since I've been doing the training, I've learned that a lot of women, including myself, who have acne, we have zinc deficiency. So that's what I'm learning now. So yes, I have a list of fish oil you, like what type of supplements we should be taking, how high it should be. That's what I like about Face Reality is they have a whole section just for Fitzgerald 4 and up. That's us. And they teach just for us before and after. So that's why I took the training. They have the Caucasian side, but they have a side where you learn just about us. And a lot of us are zinc deficiency. Me, myself, I don't eat vegetables like I'm supposed to. I don't eat fruits like I'm supposed to. So I know I'm deficient in a lot of things. And it's never too late to start fixing your body back up. Smoking cigarettes, it's never too late to quit smoking cigarettes. It's never too late. It's never, your lungs heal fast when you stop doing things like smoking cigarettes. You'll be surprised at how fast your lungs heal itself when you cut out things. And everything from the inside reflects on the outside. Everything. Yep. Biotin is great. It gives you strength, your hair, your nails, your organs is great.
Since you've been practicing, have you come across individuals who may have not recognized they have some abnormalities on their skin? Because I know the skin, as you indicated, can tell a lot. It tells us at times what's going on. So when you look at someone's skin and you see abnormalities, how do you inform them? And then I know the recommendation is go to a dermatologist, but most people jump first to cancer. So how do you handle that?
Well, it depends on the abnormality. And yes, the first thing we do is go to Google, be all sad, fake doctor ourselves. But the first thing, I have not came across none of my clients yet that I have ask them to go see a dermatologist. So I can't really say how it would go about, but I would let them know that, not to Google, not to get scared, because the dermatologist is not, sometimes you go to dermatologist and it just be acne. It could be anything. So I don't know how I would handle it, but I would definitely let them know. I wouldn't try to treat them at all. I wouldn't give them a recommendation. I wouldn't act like I'm a dermatologist, no doctor. I wouldn't use Google for them in front of them. I might Google when they leave just to see, but I wouldn't use it in front of them because I wouldn't want them to be hyped, scared. And I would not treat them, because I wash your face first twice, then I look at your skin. So once I see your skin, if it's something there that looks abnormal, I'm going to let you know. I'm going to turn the light off and let you know, that you should see a dermatologist, and then come back to me after the dermatologist let you know if it's safe to have an esthetician work on you. Because some things an esthetician might flare up. We might mess something. We might use the wrong product, and it might flare up the abnormality wrong, or like eczema wrong. So I'd rather be safe than sorry. So I would definitely recommend the dermatologist first.
Okay. So the next, this is actually a statement, wondering if this is true or not. Is it, okay, I don't know how true it is. I heard the oily your skin is, you have thicker blood. Is that a true statement? Or is that a myth?
I've never heard that. I will look into it. I don't know, because the oil comes from sebum glands. I don't know. I mean, I've just finished school, so I have the book directly still in my brain, and that was my favorite section, was glands, oil, because that's me. And I don't remember reading that at all, but I will look that up. And also another thing I wanted to say is a lot of washes, makeup, they say non-pore clogging. A lot of makeups and washes do not have to go to an FDA regulation. So they can lie on the front of the bottles. So if you don't know what ingredients are pore clogging, you'll just buy it. And you'll keep buying it and keep buying it. And it'll be the cycle of acne, which will never stop. I also have a list of that I could I guess if you email me, I can give it to you as a list of ingredients. And before I give anything to my clients, even to myself, I read it, because it'd be the simplest thing that you think is not in there, and it's in there. And even makeup. We look through makeup, and a lot of makeup have things that clog your pores up, and you'll never know it if you don't know what to look for. So that's also something that happens with people with acne, is we think we're using something that says pore clogging, and we're using it and we're washing our face with it, but it really has ingredients that clogs our pores, and they don't have to answer to nobody. I can actually makeup. I can go on wholesale online right now, add my name to a label of makeup, not even makeup, a face wash, and not even know what's in it, and I can sell it. no one can stop me. There is no FDA telling me I can't do that. So I could be clogging your pores up with some stuff and you will not know it. You know what I'm trying to say? So that's another thing that scares me. They don't answer to no one.
Next question. Where are you located?
Durham, North Carolina. I'm from New York. I just moved here about 2.5 years ago. Yep, I went to a beta. That's where I graduated from.
Okay.
I graduated from a beta. That's where I graduated from. Yep, a beta, Chapel Hill. Yep. I wouldn't recommend it to nobody though. Oh, they want to teach you the beta way. A beta way is Caucasian way.
Are there good products?
A beta?
Yes.
I like their composition oil is my favorite. Their hydrated mask. And that's really it. It depends on your skin. I use my beta project products on my Caucasian clients. I use my skin scripts on my African American clients. So that's how it goes. So Aveda has good products, but it doesn't work for me. So I would assume it wouldn't work for people who look like me. So I use it on Caucasian people.
I know you have a yay for North Carolina. You got a lot of North Carolina people here.
Oh,
North
okay, yes.
Okay, they say yay, yes.
Yes.
They're waving
I
their
mostly
hands, so
specialize in
that's awesome.
I do facials and everything, hydrofacials, but I really, really specialize in Brazilians, J shoes. That's really, really what I do. But I do facials. I like them. And acne. I like anything that goes with us.
So I have a question. How much does a facial, what's the average you would pay for a facial?
Every esthetician charge different because it goes with where you live at. Where's the area at? Because I have friends in New York who charge way more than I charge. And when they talk to me, they say I don't charge enough. I don't feel like that because it depends on where I live around, how much they can afford. My facials is my regular facial that's like a signature facial, that's $70. And it's a signature facial, meaning like once I look at your skin, whatever's wrong with it, we work on. My acne boot camp is $130.
Okay.
Totally different. So it depends on what you're coming in for and really where you live at. I plan on moving to Charlotte, and when I move to Charlotte, I will raise my prices because Charlotte is more upcoming. They make more money. It's a different area. So it depends on where you live at, how much a facial is going to cost you. And I'm more into educating my clients. I'm not into keeping them coming back. I didn't get into it really for the money. I didn't never even looked up to see how much money I would make. Someone recently told me how much yearly they made as an esthetician. That wasn't why I went into it. So I educate. I give away everything I learn. I give away, like always. You know, that's just who I am without being an esthetician. So, you know, so it's nice. It's good. I love it.
Nice. Okay. Okay. So Jennifer Hall, she says a basic facial in New Jersey costs an average of $60 to $70. So just in case, ladies, you want to know that, I'm glad we're able to find that out, because as you are suggesting to us that we should at least try to do this once a month. So what products, or if we're able to email you, say if we wanted to, cost effective, not go out and get this done, is there a list of things that we can use and do our own facials?
Yes. I can actually make up a list.
Okay.
I guess I could make up one that would be like a oily, dry combination. And a list of things that could possibly be bought from. You have to give me like a week because I want to look up the ingredients. I want to look on my list to make sure none of them have ingredients that clogs the pores. But yeah, and then you could follow on Instagram. She's not African American, but she's brown, and she gives good tips on approvals. I'm gonna put her email. I mean her Instagram. She gives good tips on good products that's efficient and that's good for brown people. And her products be good. I look them up after I see her post them, and they be good. She put up good products. Not all of them, but they really be good products that cost efficient. So I usually look on her page, and then I go from her page and I look them up myself. So I'll also post her page in the chat. I think it's Dr. V, but I'll make sure.
Tasheen, this is Dr. V. Okay, this is also for you. Thank you so much for sharing this info. There's so many Black women that think massage and facial is just luxury.
Yeah.
And we have another thanks bunch. Yes, and it's so true. We have to get to a place where we are taking care of ourselves, and that is the purpose of these the 2-day summit, to learn what we can do to take care of ourselves and do better. Those of us that want to make a change, because we always say for the new year, I'm gonna do something different. Well, this is the beginning of doing something different by educating yourself on what you can do to take care of yourself. So if there's nothing else, ladies, we are going to thank Tasheen Mungo for her information. Thank you for your knowledge. We are truly our sister keeper. Yes, we are, yes, Beverly Hale. We are. Yes. All right. So if there's nothing else, Tasheen, if you can, put your information in the chat so the ladies can get it, because they would probably love to reach out to you.
Yes.
If they have any additional questions about facials, taking care of their skin, what oils they need to use. So if you can do that, that will be awesome.
I will put my business, my email, my
so
Facebook, my
if there's nothing else, thank you so much.
You're so welcome. Thank you all so much.
Okay, sounds good. All right, thank you. All right, so we are now going to move on to our next presenter. And our next presenter is Jennifer Hall. She's a licensed massage therapist, and Magic Hands is what her topic is going to be about. So Jennifer Hall, you are now up for your presentation, and thank you.
I think I'm unmuted now. Hello, everyone. How are you? Can you guys hear me okay? Okay, thank you. Okay, I'm Jennifer Hall. I'm the creator of Tahina Goddess Holistic Wellness, LLC. I'm a massage therapist, womb healer, and Reiki practitioner. If you don't know what Reiki is, that's basically just doing energetic work, which balances out the chakras of the body, and it's just a different way to keep your body whole and well, and just keeps the energy flowing through you. It's a holistic practice. So the first question I was asked is, what is massage therapy and how is it beneficial to your health? So by definition, massage therapy is the manipulation of the body's soft tissue, which is the muscles, connective tissue, tendons, ligaments, and the skin. So in massage, we use a variety of degrees of pressure, meaning like, depending on what's going on with the client, we could go harder or softer, do different techniques of manipulation, do presses and holds, and this will give different effects to the body as far as like how the muscle releases or the tendons, and we break up like the connective tissue, any fascia, like if the fascia under the skin starts to get hardened or the muscles start to stiffen, there's different degrees of pressure and techniques we could use to work that out. So the second question I was given was, what can be expected from the first massage appointment? Oh no, my apologies. So how is it beneficial? So massage is more than just a relaxation technique. Often it gets overlooked as just a luxury, as I was stating before with a woman who was the esthetician that just went up before me. She had great information. So it's pretty much just been dismissed, I feel, massage therapy as being just nothing more than just pampering and luxury. Like nobody really thinks of it as a form of healthcare. And it is like one of the best, in my opinion, forms of preventative healthcare. And I just feel like people's opinions is just pretty much rightfully so, because that's the way it's being marketed to us. It's like just a luxury, just another expense, as opposed to something that we could use to prevent ourselves from continuously getting sick, continuously being injured. And it'll cut down on costs as far as like medications go, because you're not constantly taking these pain pills. Your senior massage therapist, yes, you're paying a fee, but you have to think like it's cutting costs on medication, it's cutting costs on your doctor's fees as well. Like you're not constantly like going into see your physicians or to the urgent cares ER because you're preventing yourself from getting injured. So as well as like being treated, obviously you have to be treated with your physician as well. But like I said, it's a good form of preventative care and to add on to your already day-to-day treatments that you may be receiving. Massage has a lot of medical benefits. It can help with things such as reducing fibromyalgia pain, relieves tension and migraine headaches, improves cardiovascular health, temper effects of dementia, lowers blood pressure, reduces chemotherapy-related nausea, and decreases stress in cancer patients, helps increase the range of motion, and enhances exercise performance. Now I'll go into what can be expected for the first appointment. A lot of people, first-time massagers, they come in extremely nervous because they don't know what to expect, especially women, because they're, uncomfortable. We don't like people seeing our bodies, other than, our spouses, like we were always taught to keep covered, especially like in the Black and brown community. We're not really accustomed to like just, exposing ourselves like that. So on your first appointment, it'll be a lot similar to coming into a medical practice for the first time. You're gonna be asked to fill out a demographic sheet, which would just be your basic information, name, phone number, no social security or anything crazy like that. Just, name, number, address, how we can contact you. You will be asked to fill out a medical history and a HIPAA form, just stating that we won't release any of your medical information or services that we provided. The medical history, we get a lot of people that are uncomfortable with that as well. They don't want to release their medical history to us because they feel like, oh, we're just spa associates, like we're not medical professionals. Why would you need to know that? But it is so important that we know what's going on with you as a whole, because there's a lot of contraindications with your health that we might not be able to provide a service to you, or we might have to adjust our pressure technique or go about your service in a completely different way. So that's why we ask for the medical history. If at any point you do come in, I'll give an example. Like, let's say if you're a patient and you come in and you have severe hypertension and it's not regulated, we do have a right for certain medical conditions to refuse the service. I mean, usually people get turned away, they get very angry, but they have to understand that it's for the benefit of their overall health. If you get a massage, let's say like your hypertension, like your blood pressure is not regulated or your blood sugar is not regulated, that could be very harmful for you and throw off your numbers even worse. As well as if you have cancer and you haven't started your treatment yet, you can also be refused, because you can't get any type of oncology massage until you have began your treatments, such as chemotherapy. As far as like undressing goes, it is better to be at least from the top up completely undressed. That way we could be able to have a good even flow throughout the body and work all the muscular regions properly. If we have a barrier such as a bra that could kind of get in the way, or, we'll have to kind of like dig under the straps, and that might make people feel even more uncomfortable. So we do ask that you undress from at least the top up. It's best to get a full body massage. So if you want to just come and just have your panties, we do have ways to drape you properly. No part of your body will ever be exposed, or you will never be touching areas where you would feel uncomfortable. But it is best to undress completely, just to have like a complete flow, and we can cover every muscular region and every area of your body, and make sure everything's flowing and draining properly. So that's the reason behind you having to unclothe completely. What you can expect after your service is you might feel a slight soreness, similar to a post-workout soreness. That is normal. It shouldn't, at any point, you should never feel pain during a massage. Like, you should never be like, oh, well, I needed that, so I endured it throughout the session. You have the right to speak up at any point if you feel uncomfortable with where they're touching, or if it's hurting you, or like just any level of discomfort, like you want them to stop or adjust the pressure. Feel free to say so at any point, and the massage therapist will adjust from there. But a normal post-workout soreness is normal if the therapist went in a little deeper to loosen up anything in your body. That could be alleviated afterwards with drinking a lot of water. That'll flush your body out. That eliminates any toxins that were worked out of your systems. Any lactic acid that was built up will be now flowing freely through the body. So it's good to just flush your body out. I usually tell people, like, whatever you normally drink, if you are a water drinker, just double that up. And that would just help release everything and prevent from the body from being sore. So it'll be like, maybe last a day or two, but as long as you're drinking water, it'll flush right out. So 3 was how massage therapy is used in the treatment of current health issues. So massage is used to treat current health issues. Research has shown that the massage can reduce heart rate, lower blood pressure, and increase blood circulation and help lymph flow. It also increases the endorphins, and this can enhance the medical treatments such as the treatment of, I messed that up. Enhanced medical treatments such as treatments for anxiety and depression. It is a great form of pain management. Massage can aid in quicker post-surgical recovery time, as well as heal repetitive stress injuries. So if you have a stress injury, such as like constant tendonitis or tears in the knee, perhaps from an old sports injury, massage can help the body heal itself and keep it from tightening, which is primarily the cause of the stress injuries recurring so frequently, because the muscles tighten like a band. And any sense of movement, it snaps. You could get tendonitis, soreness, inflammation in that area because the blood is not moving properly because everything's so tight and congested. So just massaging it, doing a little bit of range of motion, getting that mobility back, the flexibility back in the area will help prevent it from coming back. So it will lessen like your chance of getting repetitive stress injuries, as well as post-surgical, because the body is tight around those areas. You loosen the muscle because muscles have memory. So if the muscle was tightening, trying to protect the area where you had that surgery, because it's kind of like babysitting it in a way, like, oh, we have to protect this area, it's injured. Your muscle has memory, so it's going to keep contracting in that same area and preventing it from completely healing. So if you make the muscles more pliable and just make it go back to where it's supposed to be naturally, it regains that memory and it will just go back to how it was before the injury or before the surgery. And as far as post-surgical, it is also good for lymph drainage. Sometimes we build up a lot of lymph fluid after surgical procedures, and that just helps drain everything out, drain all the fluid and get the circulation pumping back in the area. They are using a lot of massage therapists now for post-surgical. I know a lot of women, I'm particularly not for it, but a lot of women now, especially my age, are getting a lot of, plastic surgery, breasts, buttocks done. That helps with preventing any infection or long recovery time for these surgeries like that as well, any type of cosmetic surgery. So 4 is, how often should I get a massage? I say clients should get a massage if you don't have any type of severe ailments or like chronic pain. I say once a month is fine to get a massage. If you do have chronic pain or a medical condition, then you should set up a treatment plan with your massage therapist, and that will be developed with your individual needs. You'll discuss with your massage therapist about how long after your massage are you feeling the benefits, and it'll be fine-tuned from there. So that's just pretty much is based on your individual needs. So anywhere from once a month. I have clients that come see me once a week. Those are people that are either really active and into sports, or like they have chronic pain and need to be seen weekly. And I have others that are a little bit less, like in the middle, more moderate pain. They come see me bi-weekly. 5 is, what are the long-term benefits of massage therapy? Long-term effects of massage therapy are better coping with anxiety, depression, increasing range of motion, reduces or eliminates pain, lessens the chance of illness, such as the common cold. Frequent massage will also allow you to be more flexible and limber into your older age. I have a lot of geriatric clients that come see me, and when they first started to come see me, they were very stiff. Their range of motion was very limited. Their joints, a lot of them were experiencing arthritic pain. Some were coming in with fibro, and now they're definitely, I see a great improvement in these clients. They're way more active when I see them coming in, just coming from the waiting room into my treatment room. I feel like they're walking better. You can see in their gait has definitely changed. They're telling me the arthritis pain is definitely easing up. And just like their overall muscular health is changing. You can feel they're no longer stiff. Like before, their muscles weren't pliable at all. Had to use a good amount of force just to try to get everything to move. So it definitely helps as a preventative for older individuals, keeps them flexible, more active, and just, be able to function overall in their day-to-day life. Massage keeps you from getting sick as frequently because you're draining all those toxins and you're eliminating that. So the toxins aren't just sitting in your body. Helps with stress relief, which is something right now is definitely needed. I feel like we don't take time to deal with our stress. We kind of just swallow it and just like, oh, well, it's not that serious. We don't really allow ourselves to say, I am stressed. I am feeling depressed. I feel like these feelings are coming on. So let me do something to prevent that. I feel like a lot of us, especially Black women, we just kind of been taught throughout the ages, just, you got to swallow the pain. Don't complain. Just get up and do what you got to do. And that's it. Don't talk about it. We're taught to, just ignore our stress. And that's so unhealthy because we get to the point where it builds up so much that other underlying diseases will come from that. Like you could get chronic anxiety from that, chronic pain just from being overstressed. You could get hypertension, things of that nature just from being overstressed and overworked because we're just on that constant go, go, go. 6 is, how do you know when your massage was done right? When your massage is done right as soon as you get off the table. In most cases, sometimes you'll have like kind of a hard time getting off. You might get like not a real extreme dizzy, but like a little wobbly feeling. Your limbs will feel very loose. kind of spaghetti-like, and it takes you a minute or two just to regain yourself after you step off the table. We refer to this as kind of like having a massage drunk, which is kind of like a great euphoric feeling. This is caused by, like I said, your toxins are releasing, the endorphins have increased in your body. So your body's just kind of getting adjusted to all that. So you should have that feeling. You should have no extreme feelings of pain. You might feel like that little muscular soreness, but that's actually a good thing. Let's see. And just in addition to everything that was asked, I just think that women just need to take more time for self-care. We need to kind of implement this in our day-to-day routine, at least once a week, even if you can't afford to go to a spa. I know it could get costly, but just take one little night out the week for yourself. Like, I'm gonna soak my feet after work, put a little detox or a little salt and soak our feet, do a nice scrub, like moisturize our hair, do a good cold wash, however you try to do your hair routine within the week. I know I cold wash maybe once or twice out the week because my hair is extremely curly, or do a deep condition, do a mask on your face, like try to implement a good facial regimen for as far as washing our face every day and cleansing our face at night when we come home. And just take time just to love on yourself. We do so much for other people. We never really stop to take time for our own selves. And if you don't care for yourself, you can't care for others. Women in general, especially Black women, we're the backbones of our families, our communities, and we're such a major asset, but we never take the time to care for our own selves. So that's pretty much all I have to say. Just be sure you love on yourself. If you never got a massage, definitely go ahead and try that. And that's all I have to say. Thank you.
Okay, thank you. Thank you so much. So I am now going to go to the chat to see if there are any questions and comments to what you have presented today. Okay. Give everyone a few minutes. Very informative. Where can we contact you for a massage?
Right now, I'm currently at Hand and Stone in Hainesport, New Jersey. That's in Burlington County. Before COVID, I was doing pop-up chair events, but that got shut down. But I was servicing South Jersey and Philadelphia, sometimes New York, depending. Pretty much this tri-state.
Okay, so if there's not any more comments or questions, Jennifer Hall, I thank you for your presentation today. You provided some awesome information, and she is very much correct that we do have to take care of ourselves because we are the backbone of our families. We do take on a lot, and we can become stressed. And if we can at any time fit it into our schedule, try to take time out for yourself and seek a massage. And now you know where Jennifer is. So Jennifer, when you get a chance, could you also put your email address in the chat, as well as where they can contact you in Hainesport at, is it Massage Envy?
Hand and Stone.
Okay, Hand and Stone. So put that information in the chat for the ladies, okay? And Now, we are now going to take a 15-minute break. And then when we come back, I will be presenting as well as Dr. Veronica Hardy. Okay, so I'm looking forward to speaking to you all in another 15 minutes after our break. So we will see you then. to you all too, because that's necessary, that we are able to have contact and also a directory for that. So thank you for that question. I have a few friends that could benefit from therapy. Do you have a private practice? Okay, so I am actually in the midst of working on that now. Thanks to the state of New Jersey, I had to kind of start all over. So right now, I'm working to get what I need. And once I'm done, I am going to have my own practice, my own private practice. But my workaround for that is developing the group that I have right now. I know some people may not want to work in a group setting, but at times it could be beneficial because of the connections. But if that person is seeking therapy, as you indicated, some of your friends that are seeking therapy, they can come through the Council for Relationships, and they still would get me as their therapist. Thank you. Thank you. Great presentation. Didn't know the difference between therapists and counselors. Okay. So I'm glad now that you have the differences. And then as I indicated, that the end goal is to make sure that you're getting the healing that you need to get. You're welcome. I have great presentation, much needed information. You're quite welcome. How do we become a member of Candid Conversations? Okay, so for Candid Conversations, to become a member, you go on Facebook, you will look up Candid Conversation with Dr. Diamond, and there you will find a series of questions. You'll read the questions, and then I will have a conversation with you. Through trial and error, I have learned to do this a different way, because I'm trying to make sure when I bring members together, they understand what the purpose of Candid Conversation is. Having candid conversations that may put you in a place where I'm going to make you uncomfortable. You're going to talk about issues that you've been hiding for years, and you're going to build trust and a connection with these other women that will eventually become your support, and you will support them. So the way to find me is Candid Conversations with Dr. Diamond. You can look me up there. And right now I do have one group, and my plan is to open another group, because I don't want to overwhelm the groups. So the max in each group will be 15 members. My phone keep auto-correcting. Okay. Have you found an increase in clients reacting to COVID-19 and the uncertainties of the unknown? Okay, although I haven't had clients talking about that at this time, but I do work around people that are very, very, very concerned about COVID-19. And that's some of the people that I work with in the prison. For me, I do have an open door policy where they can come in and they can talk, but I can't work in the therapeutic capacity, but I do try to encourage, have them feel, you know, help them feel that feeling of getting out of that nervousness, because it is nerve wracking. This pandemic came in almost like a plague, and people are afraid. They're definitely afraid of what it will do, what will happen with loved ones. But I do, and I am volunteering on the listening. It's called the listening line for the listening line is for our community. It is based out of New York. And I am actually not working as a therapist in that capacity, but I am providing a line and listening to those that are concerned about COVID-19. A lot of us got together, psychologists, therapists, a lot of us are doctors. So we all got together, and we're working on helping our community deal with such things as COVID-19. So the listening line, I can provide that information. So if you are coming across people that are very concerned, and they're not able to go into therapy, but they can call into the listening line. It is exactly what it is, a listening line where they can call, talk about what their fears are. And I would recommend that for anyone who just want to talk about COVID. Okay, so I'll put that information in as well. You're welcome for the information. Someone told me about okay, yes, I saw that too. The www.findadoctor.com, they may have therapists. Yes, and I'm thinking about, I saw that one too. Thank you. May we have the information for the group that you work with, counselors? Okay, I will, so that I may share the information with my friend. I sure will. I'm going to put that in that information in the chat right now, so you all will have that information. Are there any other questions or comments? Okay. Well, thank you so much for listening to my presentation. And next up, we do have Dr. Veronica Hardy. So Dr. Hardy, she will be addressing coping with trauma and when to seek therapy. So I am going to turn it over to Dr. Hardy. And thank you so much, Dr. Hardy, for giving us your time today.
Thank you. And I'm so glad to be here and for the invitation to be here as well. So I hope you can all see the PowerPoint okay. And like Dr. Piercy mentioned, I will be focusing specifically on trauma. And I appreciate how Dr. Piercy shared about counselors, therapists, and life coaches as well, and the differences, because that can really help someone determine what type of intervention or what type of professional they want to connect with in order to learn how to cope with issues pertaining to trauma. So like mentioned, my name is Dr. Veronica Hardy. I am a licensed clinical social worker. My doctorate degree is in counselor education and supervision from Regent University in Virginia. I'm currently a professor of social work here in North Carolina at the University of North Carolina at Pembroke. And I'm also an author and public speaker, and also focus on awareness and prevention regarding human trafficking and multiple other types of topics. So that gives you a little bit of background about me. I always like to put my website here. If you'd like to learn more about me, you can find me at drveronicahardy.com. Also, during this presentation, I really enjoy the power of story and how being able to hear someone else's story helps us understand the commonalities between us as human beings and the types of experiences that we go through. So part of my presentation today will be a reading, an excerpt from a book that I'm working on that will be published on March 1st called Becoming Untangled. But the reading is going to share about someone's specific story in regards to their own trauma reaction. So this provides some of the areas that we're going to transition through today. More so, what is trauma and how does it impact us? When should you seek therapy? And then an example of trauma and the symptoms. And that's where the reading comes in to give us a good picture of that, a real life experience of that. What is the role of professionals, the counselors, the therapists, or even the licensed clinical social workers in being able to respond to this? And what are some of the long-term benefits of seeking professional help? So like I mentioned, I would like to open with a brief story. And of course, you can sit back and relax and just tune into the words that I share. And this book excerpt is called The MRI Effect. And I will begin reading this to you. And like I said, please feel free to just tune in and listen to the words. This says, I have a dear friend who told me about a terrible work incident that had a lifetime effect on his quality of life. The physical aspects were noticeable, but it was the mental effects that were eventually revealed. This injury resulted in multiple medical appointments to determine the impact on his body. During one of the medical procedures, he was relegated to a confined space known as the MRI machine. The purpose of the MRI machine is to scan the body and assess for any types of damage to the internal organs. His experience during this medical procedure revealed that the injury extended further than the physical impact. It also resulted in mental and emotional changes. During the process of entering the MRI machine, he was triggered. In other words, his memories were activated, his emotions were sparked, as if the work-related trauma were reoccurring or happening again. He was no longer able to complete the procedure and pulled himself out of the machine. The medical staff had never observed such a response and lacked knowledge of the reason behind his reaction. Unfortunately, the machine was a tight fit, and the rubbing of the machine against his arm triggered his senses and his mind to believe he was reliving the incident. When he finished sharing his story, we named it the MRI effect. And this was an analogy for the kind of response he had when his arm rubbed the inside of the MRI machine. In other words, the sensation of his arm against the machine triggered painful memories, memories of what led him to be in that machine. In other words, the MRI effect was an analogy for a post-traumatic, after a traumatic and harmful experience, stress, pressure, tension, response, reaction, or reply that many people tend to experience after a painful life event. Post-traumatic stress disorder. Due to the impact of his experience, he became dysregulated, behaviorally, biologically, and emotionally impaired. In other words, his body and mind were affected. His sleep patterns, mood, and even the way he was interpreting the world changed. Overall, because he was in this constant state of dysregulation, in other words, off balance, his body interpreted that he was in turmoil. It was important for him to realize that these disruptions were not going away. It was just building. So when more stressors began to enter his life, they were compounding upon the stressors that already existed. Quoted from Becoming Untangled. Again, that story about the MRI effect truly captures the impact of traumatic incidents on the person, both physically, biologically, mentally, and emotionally. But what is trauma? Trauma is often referred to as an actual or perceived event, threatening event, or damaging event that a person may be exposed to. And these types of events can happen on an individual basis, meaning experiencing a rape, experiencing some type of abuse during childhood or adulthood. It can be experienced from a type of disaster, such as flooding, hurricanes, or a situation such as war. So again, there are various ways that a person can experience a damaging, threatening event. What does trauma do to us? It impairs our abilities to cope. I like to describe it as overwhelming our senses. Trauma is an event that overwhelms our senses to the point that our usual coping techniques, the way we would normally cope, will not work in that particular situation. So the person feels like there's been a breach of safety, a breach of their ability to function and to even navigate the world in the way that they're used to. Trauma tends to leave mental and emotional wounds. In other words, it creates these shifts in our thinking. We start to perceive the world differently. We start to perceive ourselves differently. We perceive our interactions with other people differently. So all of these shifts within us start to take place. And those mental wounds result in a biological response. And when I say biological, I mean within you. In other words, you may feel your heart racing. You may feel your jaw clenching. You may start to experience sweating, heart palpitations, having a fear of, am I having a heart attack? What is wrong with me? So in other words, your body internally is starting to respond to what your mind is telling it. So your body is not able to interpret that, well, this person's not actually going through a traumatic experience. Your body is only interpreting what its mind is saying to it. So again, if we refer back to the MRI effect, he had a work-related incident, but back in the machine, once it rubbed his arm, his mind was saying he was back in the incident. So the body didn't know. So the body did what? Gave him the adrenaline, gave him the energy to remove himself out of the MRI machine, to remove himself from the situation, to remove himself from the memories and the emotions that were connected to that traumatic incident. So in other words, when it says these mental wounds result in biological responses, oftentimes someone who experiences a traumatic event may be in a constant place of hyper arousal, looking, trying to protect themselves from the situation by any means necessary from re-experiencing that situation, something similar to it, or the emotions that are connected to it. Your nervous system, again, internally is overactivated, is highly on alert. I have on the next point here that it says your senses are overwhelmed, just overly stimulated, possibly jumpy. Your body and mind are sending messages of constant danger. And just think of that constant message and the impact on your body, the impact on your emotions, and how overwhelming and exhausting and draining that may be. I mentioned earlier how it affects how a person views and navigates the world, because now the world may be perceived as an unsafe place. If you have ever experienced a car accident and trauma in response to that, you may feel like driving is unsafe. It's not as pleasurable or enjoyable or a necessity as you thought it was. If you've been in a public place where someone threatening has come in, for example, there have been school shootings, shootings in malls. So now our mind shifts. How do I protect myself? Because my sense of security has been breached. I need to start navigating this world differently. So you start to enter into these places, your cars, the school, the mall, differently, looking very stimulated, hyper aroused, expecting that what has happened in the past is going to happen again at any moment. Trauma may also create barriers around the self because the security and safety have been breached. I describe this as the person's world becomes smaller, because oftentimes people will remove themselves from situations that either remind them of the trauma or may trigger emotions that they experienced during the traumatic event. Just to give an example, some people may stay home and just order, have their groceries delivered, have products delivered, because now going out, it's not safe anymore. So again, their world, their interactions, their circle tends to become smaller. And of course, it's for this self-protection reason. Like it says here, the person tries their best to control their environment. And sometimes those efforts makes their environment smaller. But again, this is a self-protection technique that the person is using, mainly to the best of their ability, because they may not know how else to go about protecting themselves. Again, a significant symptom or response to trauma is seeking to avoid re-experiencing anything that may be a reminder to the event. And when I say re-experiencing, unconsciously thinking, what can I do to keep from re-experiencing? Because oftentimes we're not thinking intentionally, well, I don't want to go there because this is what I experienced before. It seems as if unconsciously our mind is communicating to us, no, I don't want to go to that person's house. No, I don't want to get into the car today. We're not thinking of the reason. It's just our mind is remembering that trauma. Isolation, avoidance. So the person becomes cautious in order to not re-experience those emotions again. I was saying earlier, when it comes to trauma, the person's usual coping skills are not effective. The situation is so overwhelming that the normal coping skills that have been effective for all these years are not effective in this situation. So now, because what I was used to doing is not as helpful, I'm going to avoid, I'm going to isolate. And again, the person may not be aware that this is the response, but the goal is to stay separated from fear, stay separated from having to think those thoughts again. So oftentimes we'll hear it's referred to as a diagnosis, a mental health diagnosis, which is like a medical diagnosis. For example, Alzheimer's, cancer, etc. So there are diagnoses as well for our mind, our body, how we function, how we interpret life, how we navigate life. So post-traumatic stress disorder is one of those diagnoses. And the thought is that once you have a name for something, then you can have a sense of control of it. You can have an understanding of how to respond to it. And I wonder how many of you have ever gone through that. You've experienced something for years, didn't know why you were experiencing, didn't know what to call it, but then you hear someone else's story and you think that's what it is. And finally, you don't feel alone in it anymore because other people are experiencing it. And this is what it's called. And now that I know what it's called, I feel like I can actually step in and do something about it, or do something about it differently than I was before. So post-traumatic stress disorder, you'll see that several of the symptoms in regards to this, you saw in the story about the MRI effect, and you saw on the previous slides that I have shared with you. Generally, the symptoms can occur immediately following the event or within 30 days, and the symptoms can last a lifetime. But it also depends on when a person seeks professional help, or if they find themselves at a point to seek professional help. Like Dr. Piercy shared earlier, there are multiple forms of professional help that a person can pursue. I have the term recovery here, but I really like the concept of post-traumatic thriving. How do I go about thriving after experiencing some type of traumatic event, whatever that event was for me? And I want to identify that trauma and our reactions vary according to the uniqueness of the individual. So one person's response to a situation may differ from another person's response to a situation. Yet neither person is wrong, because we have different sets of coping skills, different ways that we've all been raised. So all of these factors, like it says here, recovery depends on multiple factors, including your uniqueness and when you make a decision to pursue professional help. And whatever that help may look like for you. It may be the counselors and therapists, or it may be at your faith-based institution. Or it may be a type of support group. So again, the forms of help can vary based on your unique responses. When should you go about pursuing help? One thing about trauma is that it hinders our ability to function the way we used to. So when you feel like you have been impaired in your functioning to the point of, I feel like there's nothing I can do about it. There's nothing that I can control around this anymore. When you start to feel like that, it may be time to pursue professional help. Or if you get to a point of integrating coping skills into your life, we have what is referred to as healthy coping skills, and then what is unhealthy coping skills. And unhealthy coping skills come in when there may be this sense of dependency, okay? That makes it unhealthy. For example, using alcohol and substances where you're not in control. It's as if the substance now is controlling you. So when you find yourself developing a sense of dependence, something that is different from your usual pattern or habit, that can be a reason to start pursuing professional help. when you're realizing that your functioning in the workplace is declining, or your functioning in your family and other personal relationships are becoming intense or even declining, or other people are becoming frustrated and moving themselves away from you, decreasing their interactions with you, that can also be a sign. So overall, paying attention to when or if your daily functioning is becoming so impaired that you're coming into a place of isolation, avoidance, your relationships are decreasing, or you are developing a sense of dependency on a substance or other type of habit or addiction. Okay, so what can be the benefits of pursuing professional help? One, the benefits can include recognizing the triggers and defense mechanisms. Okay, triggers are those things, those signals that remind us of the situation that we have been through, or whatever that trauma may have been. And I recall my own, there was a point where I was in a car accident. It was just a one vehicle accident, mine. And I had hydroplaned on the road, which meant I no longer had control of the car. It was just riding on a thin film of water. The car spun, hit a tree, spun, hit another tree, spun again, and then went through a fence. Of course, the car was totaled. I'm thankful I was okay. But my triggers now were curves, wet roads. So overall, anything that reflected water in regards to driving, or curves. So I noticed if I would see a bridge, if I'd have to go through a tunnel, if it was raining, if a tight curve was coming, my body would start to react, because my mind was being triggered to remember the past, that this is danger. This was a perceived threat. This was a threat to my life and very damaging. So again, I would sweat, I would tense up, my heart would race. So what defense mechanisms would I put into place? Defense meaning defending yourself. Mechanisms meaning coping or techniques. So my defense mechanisms were, well, I'm not riding in the rain by all means possible if I can abstain from it. Or I would drive very slow, or I would pull off the road. So there were all these ways that I sought to defend against re-experiencing or reliving what I had experienced before. But that led to isolation. It decreased my driving, it decreased the places I went, and it decreased when I went. Understanding and regulating the body. This is something else that professional help can aid us in doing. Why is my mind processing the way that it is? Why am I thinking the way that I am when this incident happened 10, 15, 20 years ago? Why do I continue feeling like it's happening in the moment when it's already over? So that person will help us to process those thoughts, and even to allow us to think about it. Because remember, a characteristic of post-traumatic stress disorder is to avoid, to the best of your ability, even thinking about it. So to be in that safe space with someone to guide you through those thoughts and to help to soothe you, calm you, and to even teach you ways to self-soothe is another benefit of professional help. And by the end of this presentation, I want to implement or take you through a technique to be able to regulate, control, calm, and self-soothe your own body and reset your mind. Another benefit of professional help is to integrate social supports, and that can be people around you. Again, your faith-based institution, friends, you name it, to compensate for areas where you still need to be strengthened during stressful periods. So in other words, these people can help compensate during your periods of stress. So when you're not able to focus, when you're not able to function, you have someone, a support, who steps in and helps to fulfill certain roles and help to lift you up at those times while you are going through your process of healing. And I also often want to say, when we use the term healing, I have a different definition for it that I've come across, that healing also means to push out. And in my book, Becoming Untangled, that's how I define healing: to push out toxins, to push out things that are harming you, to push out things that are holding you captive and bound. And that's the idea of healing. So to be able to push out this control that the trauma has over you, to push out those fears, to push out those thoughts. In other words, to be able to heal from it. So what I want to do now is I want to take you through this activity. Okay. Remember, I said that a professional can help you reset and regulate your body, teaching you techniques to be able to do that. I say oftentimes most of us spend most of our time in the past or in the future. And when I say we spend most of our time there, I mean mentally. And many of you may be able to relate that we pour a lot of today's time into what happened yesterday, or we pour a lot of today's time into what we think is going to happen tomorrow. And we spend very little time in today. So this resetting technique that I'm about to take you through, if you feel comfortable doing so, is called a grounding technique. And grounding is a form of support, say for our minds, our bodies, and it helps us to reset to the present. It's not a cure for what we're experiencing, but again, it helps us to regulate our bodies, calm ourselves down, and to be able to reset and focus on what are my thoughts, what just happened, what triggered my thought, why did my mood just drop, why did I get anxious? So it helps to ground us, give us a firmness, give us a support just in that moment to slow us down enough that we can reset, focus on the present, and respond to our needs in that moment. So like I said, this technique is called grounding, and I invite you to participate and find a comfortable position to be able to sit in wherever you may be. Okay, and you can also feel welcome to close your eyes during this experience and just listen to the sound of my voice and the direction that I will be giving. So let's start by finding a comfortable position. And I want you to take your time in finding that position. Now, wherever position you are in, notice how your back is making contact with the chair or the sofa, the floor, if you're standing against a wall, the bed, the earth. Just notice how your back is making contact. If you're sitting, I would like you to bring your attention to your seat, making contact with the sofa, the chair, etc. Now, pay attention and notice how your thighs, your legs, and then your feet are making contact. Bring awareness to your feet making contact with the ground. Notice the sensations that are more pleasant to you within your body. If at any point you become aware of uncomfortable sensations, bring your attention to places in your body that feel more comfortable. And I want you to stay right there for just a moment. So now, as we get ready to end, I would like you to slowly scan your body and bring your attention to all sensations that are pleasant. When you are ready, please feel welcome to rejoin us. So with that, I want to thank you for your time today. And I definitely invite the opportunity to respond to questions and engage in further conversation about trauma, its effects, and even how to reset. Thank you, everyone.
Thank you so much, Dr. Hardy. Okay, as she indicated, I am going to go ahead and open up the chat for questions and comments.
Thank you, Tamika. I would like to hear from everyone how you felt from that experience. Thank you. I see. Thank you for the presentation. Thank you for explaining trauma so well. You're definitely welcome. Oh, I'm glad you felt relaxed. Yes, and that brings back to how these techniques are the complete opposite of trauma and the anxiety reactions that, like I said, will clench. Our hearts will race, our minds will race. And when we engage in activities such as this, it brings us back into the moment and eases our minds enough that we can reset and focus on what we need to focus on. Yes, Tamika, I see how you feel so relaxed and you would love to master it. And it takes time. This something I often hear in regards to meditation. Have any of you ever sat and tried to meditate? But within the first 10 seconds, you're making a grocery list and thinking about tomorrow. So the meditation doesn't actually happen. So many people may avoid it, right? But it's a process because our minds aren't trained necessarily to meditate. So it can take multiple times. And some of us may need shorter periods because I'm one of those people who does get distracted quickly because I'm thinking of what I have to do next. So a technique such as this, such as grounding, just to reset us quickly in the moment, can be very helpful. Thank you, Michelle. That was a good exercise. It showed me how hard it is to concentrate. Yes, I'm always in multitask mode. I want to share this too. Another symptom or coping skill, and even one of my coping skills when I'm experiencing anxiety or if my mood drops or something to that extent, is what I refer to as hyper productivity. So when I see multitask mode, I perceive that as being hyper productive. I'll clean, I'll do this, I'll organize that. And I'll say, yes, this helps to calm me down. It helps me to reset. Some people may overschedule their children's activities to keep themselves busy so their mind doesn't have to think about the things they don't want to think about. Again, reliving trauma or the emotions that may be connected with it. So again, whenever we have a coping skill, each coping skill serves a purpose. It's responding to a need that we may carry, but it's important to explore what is that need that this skill is responding to, and is this a healthy way to respond to that need? Well, I like cleaning, so I view my cleaning as healthy. But at times it could be for avoidance reasons. Yes, often we as women are in that multitask mode, that is for sure. please feel welcome to let me know of any further questions, or even if you had reactions to the reading from the MRI effect in that individual's experience while in the MRI machine. And while we're waiting, I had shared earlier about the reading excerpt came from a book publication that I'm working on, which will be shared or made public or released on March 1st. And so again, that reading came from the book Becoming Untangled. So again, I thank you all for participating in this presentation today.
Thank you so much again, Dr. Hardy, for providing such a great presentation. So now with saying that, we are going to move closer to getting to the end here. And I actually have to say that I really enjoyed myself with this 2-day summit. And I'm hoping that eventually it'll grow into something bigger, because it is necessary that we take the time out to learn how to take care of ourselves, from the top of our head to the bottom of our feet, inside and outside, should match as much as we can. Because I tell you, when we put ourselves on the back burner, it is easy for us to burn out. And then we develop these other behaviors that we don't want in our lives, or we put things to the side of no longer of interest. So I do want to say thank you. One, to Beverly Hale, our RN, BSN, and certified, board certified case manager, for her presentation today. It was awesome. Taking care of me with no excuses. Tasheen Mungo, our licensed esthetician, loving the skin you're in. The purpose of loving your skin, understanding your skin, is really what she's trying to convey, and why you should take the time to even do a facial so you can feel good about yourself. Jennifer Hall, she is our licensed massage therapist, and Magic Hands. She talked about the benefits of having a massage, why it's necessary, and the benefits of it. It's not just for luxury, as she indicated. It can do so many things for you, can help you relieve a lot of stress, take you out of a feeling of sadness, and just you developing a habit of taking care of yourself. And then I talked about maintaining mental health by seeking therapy. The goal is to understand therapy. What does it mean? Why is it a stigma in our community? We need to move away from that stigma so we can help ourselves. And our mind has to be right, or as I use homeostasis, you need balance. If you don't have balance, you will feel unbalanced from time to time. So we need to get into the habit of presenting balance back into our lives. And finally, Dr. Veronica Hardy, a PhD holder and licensed clinical social worker, coping with trauma and when to seek therapy. As she also reiterated the purpose of therapy, why it's needed, and also coping with trauma. How do you learn about trauma, understanding trauma? What is it to begin with? And she gave a very, very good explanation on what it is. Because if you don't know what it is, you don't know how to handle it. As she said, when you're living in the past, as you're living in the past with these feelings, you want to understand these feelings so you can understand the healing process. As she's saying, purge, purge, purge. Healing is another way of purging and getting rid of those toxins, as she indicated. So I like that philosophy. I like that method. I like us to understand that and use that same methodology so we can look at that in a different term. So as I said, I really, really enjoyed this summit, and I'm hoping that you all can give me some feedback. And Dr. Hardy, before you leave, please make sure you put your information also in the chat. Please put your book in there, your up and coming book. Also, do you have a podcast as well? Hold on 1 second. Let me see if I can unmute you. Oh, where's she at? Okay, it's not even moving.
Oh,
Okay,
there it is.
there she goes. Okay,
Perfect.
there you go. There you go.
Yeah.
Okay. Do you have a podcast? Do you have a
Yes,
podcast also?
I
Okay.
do.
Please put your podcast information in there also, because I would like that we support you.
Thank you so much. I have a
Okay.
podcast called There's Power in Your Story. I'll post that. And I just started a video podcast series called Becoming Untangled, based on the book, where people are sharing their stories of situations in life, whether it's trauma, whether it's coping to society's response to natural hair, whatever situations that they have become untangled from.
Yes, so if you can write her information down for the future for yourself, if you don't utilize it, please pass it on to someone else that you think that will benefit from what she has provided today on trauma. Understanding trauma, understanding you, again, brings you to a place where you can identify your triggers, as she talked about, because identifying and knowing you is going to help you, again, know your triggers, know yourself, know how to step into the world of healing. Also, identifying or picking a therapist or a professional that will help you. Okay, you don't have to necessarily go to a therapist or counselor, but a life coach can assist you if you feel that that is necessary. So I hope that the information today for the last 2 days were very helpful. If you can go to Candid Conversations, which the email address is there, and you can always suggest what you would like to see in the future. What topics you would like to see, because I will like to do another summit. I'm going to start working on it as soon as I can, because as professionals, sometimes it's hard for us to have the time, but we made the time to make sure that we are reaching our community, because our community is important to us. So by all means, please provide that information to you. So I'm going to give you all a couple of minutes before we sign off for the day. But I hope, again, you all have taken away a lot from these 2 days. And I wish you all well, and wish you well for all healing inside and out. So I'm not going to shut it down right now, so you can also get your information that you need. And thank you again. So just give them a minute. They're going to write down all this stuff.